Ignoring a mental health condition is not a neutral choice. It starts a cascade of profound, unseen consequences. The most staggering consequence? Untreated severe mental illness can shorten a person's life by 10 to 25 years. Professionally, it can cripple your career. Depression prolongs unemployment and makes it hard to keep a job. It also attacks your body, directly increasing your risk of chronic diseases like heart conditions and diabetes. Here, we will break down the cascading costs of inaction and show how accessible therapy offers a powerful way back. The cost is national, draining the economy of nearly $500 billion every single year. This massive figure comes from lost productivity. An employee with untreated depression sees their output drop by 35%. On a personal scale, what starts as mild anxiety can escalate. Symptoms worsen, becoming harder to manage over time. This internal struggle spills into your relationships, causing conflict, withdrawal, and a feedback loop of deep loneliness. The mind seeks relief, often in harmful ways. This can lead to secondary issues like substance abuse or self-harm. We see the damage, but what is the biological mechanism? How does a feeling physically alter your body's functions? How does mental distress physically remove up to 25 years from your life? The biological answer is coming up. The answer begins with stress. Chronic anxiety floods your body with cortisol, which suppresses your immune system. A weakened immune system can't fight inflammation. This state is a known driver of heart disease, diabetes, and cancer. Consider it a chain reaction. Mental distress causes hormonal imbalance, which weakens immunity and promotes chronic disease. This physical breakdown is the direct pathway to that 10 to 25-year reduction in lifespan. It is a physiological process. This decline may feel inevitable, but it isn't. There's a structured, effective way to intervene. Outpatient therapy. Outpatient therapy is designed for real life. You maintain your job, family, and routine while getting structured treatment. This design makes it more affordable. By eliminating costs for room and board, it is a sustainable option for care. It also functions as a preventative measure. Consistent therapy can stop a crisis before it starts, avoiding hospitalization. This is training, not simply conversation. You gain practical coping mechanisms to apply the moment you leave a session. But how does therapy actually reverse the physical damage we discussed? Let's examine the deeper therapeutic process. Effective therapy identifies the root causes of your distress. Understanding the why allows for targeted strategies. Many programs include group therapy, which directly counters the social withdrawal caused by mental illness. The goal is staying well. Therapy gives you the tools to stop symptoms from worsening and to reduce future relapses. All these elements combine for one outcome, a measurable improvement in your overall quality of life and self-confidence. Now, let's connect the dots. How do these therapeutic benefits directly solve the crises we outlined at the beginning? We saw how untreated illness creates crippling isolation. Group therapy directly reverses this by building a community. Recall the 35% productivity drop. Skills from outpatient therapy are applied at work, rebuilding professional capacity. And how do you get back those lost years? By addressing the root cause. Therapy cuts the chronic stress that weakens you. It breaks the chain reaction. Less distress means less inflammation, a lower disease risk, and a longer, healthier life. The choice is clear. One path is a decline in health and opportunity. The other is a path of recovery and reclamation. Those 10 to 25 years are not a fixed sentence. They represent potential lost to inaction, but reclaimed by seeking help. Your mental health is the foundation for your future. Investing in it is the most meaningful investment you can make. If you or someone you know is struggling, talk to a healthcare professional about outpatient options. Share this video.